again, this is the fourth recording of the Pain Management Handbook. As usual, we're going to start off by asking you to think about the third recording. What did you learn? What were the things that you found interesting? And secondly, what are you going to do? What are you going to take forward or use from that session to make changes? So moving on to the fourth recording, identifying escape and avoidance behaviours. As we've already learned, trying to avoid pain is a problem, because the more we try to avoid a situation, the more averse to it we become. We can become afraid of experiencing any pain, to the point where we reduce our activity, and it starts to affect our day-to-day life. Here's a list of typical avoidance behaviours. Overuse of medication, alcohol and illegal drug use, seeking medical reassurance, using aids like walking sticks, braces and splints, not doing exercise or other activities, not going out in crowds in case you get bumped into, waiting for pain to stop before doing things, saying no to activities you previously enjoyed, seeking alternative remedies, not doing certain things because of pain memories. For example, not gardening because that's how you hurt your back. Not doing and avoiding things leads to increased pain suffering. Can you think of an example where one of the above behaviours has increased your pain suffering? Spend some time, and if you need to, pause the recording. Next, we look at the pain chain. The suffering caused by chronic pain usually occurs in 4 stages. Step 1. The physical pain sensation. This is followed by Step 2, the way our mind reacts to this pain, painful thinking, etc. Next, moving on to Step 3, avoidance or escape behaviours based on the painful thinking. And 4, long-term choices based on avoidance and escape behaviours. It might be useful to go back through this chain and to use an example from your own experience if you feel that this is relevant to you. So just to remind you, the steps are: Step 1, the physical pain sensation. Step 2, the way the mind reacts to this pain. Step 3, avoidance or escape behaviours based on the painful thinking. And Step 4, long-term choices based on avoidance and escape behaviours. The next exercise is about creating your own pain monster. It's a way of visualizing or separating our ideas of pain. Think about pain as something outside your body. Think about how it might look, touch, or smell, and create your own pain monster. Like with previous exercises, be ready to pause the recording to give yourself time to have a think. What shape does your pain monster take? What shape is your pain monster? Secondly, if it was outside your body, how big would it be? If it was outside your body, how big would it be? If your pain had a voice, what would it sound like? If your pain had a voice, what would it sound like? What texture would your pain have? Would it be rough or smooth, silky or like granite? What texture would your pain have? How would your pain smell if it was outside your body? How would it smell? What colour would your pain be if it was outside your body? What colour would it be? This exercise is adapted from Living Beyond Your Pain by Lundgren and Dahl. The next section is on choosing to change. Do you feel ready at this point in the course to change your pain behaviour? Do you feel ready to approach pain and difficult situations with acceptance? Are you ready to commit to moving forwards towards your values, the ones you have identified? Try to think about your pain as something that is external to yourself. You are not your pain. Spend time using maybe the pain monster exercise to illustrate this. Now you have created your pain monster. Think about what you would like to say to it. Maybe express it out loud, write it or record it in whichever way you feel best. Maybe pause the recording now to give you some time. The question is, now you have created your pain monster, think about what you would like to say to it. When talking to your monster, have you continued to use avoidance? For example, asking it to go away, or have you embraced it and learned to accept it as part of you? Typically, most people still would like their monster to go away. However, it is useful to think at this point of how you can learn to live together. Try to be kind to your monster and accept it into your life. Have another look at the cycle of change from week 2. At which stage do you feel that you are at? So just as a reminder, the stages of change start with pre-contemplation. This is loss of control, pain taking the lead, feeling trapped and wanting to change. The next stage is contemplation, planning your changes to get your personal needs met and thinking about what you can actively do. The next stage is active change, putting changes into practice and gaining control. This is followed by a period of maintenance, which is ongoing commitment to yourself to keep your choices and the changes you've made. At this stage, we can either relapse, returning to feeling unable to stick to the plan and needing to refresh, or we continue to maintain the changes that we've made. So this exercise is asking you to think about where you are in those stages of change. What heading, which word best fits where you are at? And it might be that you're in different places for different things. Next, we look at communication. It may seem strange to some that communication is part of a pain management program, but this is because it is difficult to manage our activities if we're unable to negotiate with others what we can do and what we can't do. People with chronic pain often report finding it difficult to say no when asked to do things. They also report finding it difficult to ask for help when they need it. As a result of this, it is common for people with chronic pain to overdo and enter the boom-bust cycle. In this section, we will be looking at assertiveness as a way of communicating so that we can negotiate with others about what we need. Communication is often broken down into 3 styles: passive, assertive, and aggressive. And below this text, there is a diagram of a seesaw, with passive on one end of the seesaw and aggressive on the other end. Assertive is right in the middle, where the seesaw balances on its point to demonstrate that it is somewhere between these two. You can usually see these three different ways of communicating by examining different parts of communication. Firstly, speech, the content and manner in which something is said. Second, body language, posture, distance, facial expression, eye contact and gesture. Thoughts and cognitive processes, expectations, automatic thoughts, beliefs, or whatever is the centre of attention. We also need to examine how others might feel. Next, there is a box with three compartments, exploring the components of the three different styles of communication. I will go through them each in turn. So passive, speech is in low volume, reserved, apologetic. Body language might be uncomfortable, introverted, eyes down or avoidant. Thoughts might be of being unworthy, of being self-critical and uncertain. Others in the situation may feel powerful, in control, or possibly frustrated. On the right-hand side is the aggressive communication style. Speech is classified as being in a raised voice, maybe swearing, maybe disrespectful. Body language might have examples of invading space, glaring, pointing. Our thoughts can be rigid, critical of others, and wanting our own way. Others might feel scared, intimidated, and threatened. Assertive sits between the two. So speech might be described as clear, direct, constructive, but also with elements of listening. Body language might be relaxed, good eye contact, open and calm. Thoughts, clear on our own needs. Our thoughts might be self-supportive or confident, and hopefully it will make others feel heard, taken seriously, or respected. The assertive style of communication is thought to be the most comfortable in the long term. There are problems with both passive or submissive and aggressive or manipulative styles of communication. The issues with passive styles of communication might be that we don't get what we want, that we bottle up our feelings and become frustrated, that we lose self-respect and do not value our own thoughts and opinions. Maybe we do too much because we can't say no. We don't ask for help. We may get treated like a doormat. With aggressive or manipulative communication styles, we cause conflict and upset in getting what we want. Others might feel bullied or resentful. Others may avoid us. Frustration and anger can cause more pain. We do not learn about what is actually going on as we lose the art of listening. So in short, passive communication is you are unlikely to get your needs met as someone might not ask what you specifically want. Aggressive communication, you might possibly get your needs met in the short term, but may turn people against you. Assertive communication is most likely to get where your needs are met. Assertiveness can be defined as the ability to stand up for one's own rights or opinions whilst not infringing on the rights or opinions of others. To be assertive, we need to learn the art of ensuring our and other needs are met at the same time. Below this there is a Venn diagram, so a diagram where two circles overlap. On one side there is a circle titled passive, other needs are met, and aggressive, where your needs are met. Where the two circles overlap, there is the word assertive, as both needs are met. To do this, we can use the assertiveness ladder. The assertiveness ladder, with ladder being an acronym, is a useful framework to look at things each person can do to become more assertive. L stands for look at your rights or needs. What is it that you want? What do others want? What are your feelings about the situation? Let go of blaming and self-pity. Resolve to take responsibility. Define your goal and keep it always in mind. A stands for arrange a time and a place that is convenient for you and the other person. Take particular care to calm yourself. Prepare short phrases in advance and practice saying them. The first of the two Ds stands for define the problem. Do this as clearly and as calmly as you can. See the problem from the other person's point of view. Acknowledge their rights. Don't expect people to be mind readers. The second D, the acronym ladder, stands for describe your feelings. Use I statements that evaluate your feelings without blaming others. Remember that they are your feelings and that you are responsible for them. Be honest about your feelings, but avoid venting. Link your feelings with specific behaviours. For example, I felt worried when you didn't phone. E stands for express your requests. Be specific, clear and firm in making your request. Don't beat about the bush or make vague hints. Keep your emotions under control. Don't over-explain or complain as this distracts from the request. R stands for reinforce. Let the other person know the positive consequences for them if they cooperate. For example, if you put the children to bed, I can get supper early and we will have plenty of time together. Check the request you've made is not impossible to meet. Next, we look at the advantages of assertiveness. Because you have expressed yourself and asked for what you want, you will value yourself more. The next advantage is you are more likely to get what you want. You will be less likely to go through boom and bust and the pain associated with it. Even if you have to accept that you didn't get what you want, you can feel satisfied that you have had good communication. You will improve your negotiation skills. The more honest you are, the more you can accept your strengths and weaknesses. You will experience less conflict with others. You won't feel frustrated as you won't be bottling up emotions anymore. People will trust you and feel comfortable with you. Concluding point. Assertive communication is an ideal to be aimed for. We can all fall short sometimes. The point is to learn from our experiences about what we can be done next time. Assertiveness is a skill to be learned like any other. It takes time to become skilled at it. If you change your communication style, it may take time for others to adjust to this. Be patient, honest and kind over time. Their expectations will gradually change. Safety note. Certain situations may not be appropriate to use assertiveness skills. You should assess this risk. For instance, if someone is being very aggressive or threatening, it may not be the best to engage with them, and you may wish to consider distancing yourself and others from the situation. In these situations, it may be best to pursue other avenues, such as informing the police. The next section is on desensitization, or getting used to the pain. This practice can help to reduce the impact of your pain. The normal, common sense response to pain is to try to get away from it or to distract yourself from it. But this constant trying to get away from something that can't be escaped causes stress and can even activate the parts of the brain that make you more aware of your pain. Remember, with chronic pain, the pain is not an indication of further damage. If you experience the pain, you'll be physically okay. By gently exposing yourself to the experience of pain, you can get more used to the pain and it can bother you less and less. This process is called habituation. We've been trying this desensitization practice with our patients for a number of years. When people do it consistently, they often find that the pain does not bother them as much. Of course, it is not easy for everyone, and some say that they cannot face even the idea of trying. But overall, we have found this method very helpful in reducing the interference caused by chronic pain. It can help when you're trying to do some activity or exercise, and even when you're trying to sleep. It does need practice. So, desensitization practice. Start with a simple meditation or relaxation, like the ones we've done before. Look for something pleasant or positive in your experience. When this focus on something pleasant or positive has become steady, spend some time experiencing something you consider to be less pleasant or painful. Stay with this for a short period of time. Notice your response. Maybe pause the recording here to have a go at it. Return to focusing on something pleasant or positive. And again, you may wish to pause the recording here to do this. Next, you might repeat the last two stages, focusing on something pleasant or positive, and then switching to something less pleasant, and then going back to something pleasant a few times and maybe use different experiences. Please pause the recording to give yourself a chance to do this. Finally, finish by doing a gentle relaxation or meditation. After practicing, spend a minute or so thinking about what you noticed. Try not to measure it in terms of did it work or did it make the pain go away, but rather what did you notice? Compare that with the last time you did it. You may start to notice changes in the way you experience your pain. As you start practicing the technique in shorter sessions and in different places, you can start to use the method to counteract the interferences of the pain on your daily life. Over time, the pain should become less troubling to you. We do not recommend that you use this technique to override your normal pacing of activities. You should continue to pace activities that aggravate your pain, but use the desensitizing technique to cope with your pain whenever it starts to trouble you. Next, we're going to look at a concept called mindfulness, which has been mentioned before. Mindfulness is the practice of living in the present moment. It is about experiencing and noticing your thoughts, feelings, emotions, and sensations in the here and now. Our thoughts often lead us into the past or the future. However, the present moment is the only time we can truly change and live. Think about how much time we spend thinking, if only this hadn't happened, or pinning our hopes on the future. Living in the past or future can make us feel frustrated and dissatisfied, which can lead on to depression and low mood, worry, and anxiety. Mindfulness, changing the relationship with pain. You can take the desensitization practice further and apply a mindfulness approach to it. To explain this, we will imagine something. Imagine a crowd of people getting on quite well with each other. Suddenly, the crowd splits into two groups. Perhaps this is because they support different sports teams or have different beliefs. As people move into the different groups, the group starts to get into conflict with each other. The people in the crowd started to label the people in the other group. For example, the name of a team or the name of a group that held the different beliefs to them. When the people label the other group in this way, all the feelings, beliefs about the other group, and prejudice towards the other group come along with the label. Unfortunately, the same thing happens with pain. Every time you label your pain, all of your painful history comes with it. So every time your pain has hurt you, made you cry, spoiled your plans, and made you feel upset, it adds to the meaning of your label. We need to break this label down. So the pain is just the simple experience of what is there now, not all the misery and suffering from the past that was included with the label. We do this in a similar way to the desensitization practice, but instead of visiting the pain, we look deeper into what the pain is made out of and how it really behaves. As we do this, the label loses some of its power and we are left with just sensations that the pain is made out of rather than all the associated misery and suffering that comes with that pain label. We'll have a look at how to do a mindfulness practice version of the desensitization practice. So start the desensitization practice as normal, taking the time to pause or rewind the recording as you need to. When you come to experience the unpleasant symptoms, start to look at what the pain is made up of. Look closely and experience the pain in its component parts. For example, the pain may consist of a hot, tingling sensation in the area of the lower back. Notice how the tingle changes and moves location. Notice how the heat comes and goes. You may find an ache appears but then disappears. Try to experience the sensations as separate from each other and always in a process of change. Notice that the pain may not be what you first thought it was. Notice that it is always changing, even if there is a sharp pain that demands your attention. See if you can see what this is made out of. Reflect on the fact that each of the sensation components of the pain, if experienced on their own, would be quite manageable. More strangely, some of the component sensations, if experienced at a different time, may be pleasurable. The hot sensation in lower back may be pleasant if you're on the beach with the sun on you, or a sharp sensation may be pleasant if you're having a massage. Play with this idea. See if you can change your associations with your sensations. As in the desensitization practice, periodically go back to the relaxation or pleasant sensations before continuing. Bring the practice to a close and reflect on anything that you've learned. We're going to look at another meditation now, another form of mindfulness. We are not always in the position to sit quietly or lie down, especially if we are out and about. So for this occasion, we're going to look at a moving meditation. And sometimes this is a really good one to do when we don't want to sit still. Luckily, it is possible to meditate when moving. You can do the meditation as a walking meditation, or whilst you do slow and mindful exercises, but you can also stop, lean against something, or sit whilst continuing to practice and then start moving again when you feel able. Doing this practice will allow you to meditate for longer than your tolerances normally allow, but will also allow you to meditate when out and about. The meditation can be done in many ways. The following are suggestions. Start with the mindfulness of breathing exercises that we've done previously. When you feel ready to proceed, open your eyes and stand up. Spend some time experiencing your body sensations in still standing. Maybe pause the recording here to allow you to do that. Start to walk in a location where it is safe and easy to walk. It can be easier if you go back and forth along a path or in a very large circle, so you don't have to constantly check for new obstacles. Again, pause the recording if you need to go through this. Scan through your body whilst walking, feeling how the movement feels in your body, how the swing of the arms and legs can give an impression of movements of weightlessness, and how the activity can give rise to a pleasant tingling or energy sensation in your body. Spend time going through all the parts of your body. When you have completed this, become aware of your whole body and experience walking with this awareness. Notice how you feel and what your mind is doing. If you get distracted, be kind to yourself and gently bring your awareness back to a strong sensation, for example, the soles of your feet. Note how there are pleasant, neutral, and unpleasant sensations and see which ones are tending to focus on. Try to get a broad, relaxed awareness of your body. Maybe pause the recording here. For interest, notice how slowing down, speeding up, and stopping affects your mind. Gently slowing down, being aware of the increased sense of awareness as you do this. Note, walking is more difficult when very slow, as it requires better balance, so bear in mind that this is happening when you're practicing. Again, maybe pause the recording to allow you to focus on this. Stand still and notice the tingle or energy of your body that often arises when you stop with this practice. If this is pleasant to you, enjoy this. Finish with a short sitting meditation or relaxation of your choice. Try this practice at home, but also try dropping it into everyday life, for example, when out shopping or when walking. That's everything from week 4, or the 4th audio recording of the Pain Management Program Handbook. We will continue in the 5th recording of the Pain Management Handbook. Thank you for your time. Goodbye.